Welcome to Module 1. We are going to discuss the history of couples therapy and some of the basics and just really dive into some of the different therapeutic approaches. So let's look at the basics of couples therapy. So, what is the goal of couples therapy? Well, it's to reduce or eliminate distress. And the counselor's role in couples therapy differs just slightly depending on which therapeutic approach you use. But the counselor's role is to help guide and collaborate. So the counselor helps the clients find ways to function optimally. So, now what about the sessions? Well, the sessions are generally once a week for an hour. Some meet for 2 hours, but generally it's about once a week for 1 hour over about a 3 to 12 month span. And the couples meet conjointly, meaning they obviously meet, as a couple with the therapist. Sometimes there's a co-therapist involved. So what different modalities do we have? Well, now we have in person and we also have virtual therapy. So think about that. There's some benefits and there's also some some weaknesses to telehealth or virtual therapy. And one of the benefits is obviously that the meetings can occur from any location as long as the therapist and the counselor reside in the same state in which the counselor is licensed. Um, so, but the one of the challenges of doing couples therapy, especially the ones that I've encountered, is that a lot of times a couple will decide to do therapy, but the husband or the wife will be in a different location. So the husband might be at work, the wife might be at home, or vice versa. And so then they kind of want to patch in together and into a Zoom session or Doxy.me, whatever platform you use. And that doesn't always work so well because one of the benefits of couples therapy and seeing couples face to face or in person is how do they function together? You want to observe their nonverbals. You want to observe how close they sit to each other. Obviously, when you're doing virtual therapy, that's not so easy to do, especially if the couple is actually in separate locations from one another. So that's just something to think about. So another basic of couples therapy is we've kind of gotten to this age of pluralism. Years ago, we called it eclecticism. And, first it was frowned upon because, they thought that you had to pick one modality and you had to use that therapeutic approach. Being eclectic was kind of almost taboo. And but now we've kind of moved to this position where it is amazing and awesome to be able to pull from different therapeutic approaches to have this can't even say that, pluralistic approach, or kind of an integrative approach is really what we call it, and it benefits the couple. So because we're able to pull from different approaches and find what works for our couple. When you begin working with a new couple, you're going to want to do an assessment with them. And the assessment is kind of a three-part process. The most important part of this process is the clinical interview. And the clinical interview is really when we ask the couple questions. Individually, we want to know about them as individuals, but also as a couple. So we might ask them questions about, individually, we might ask them about any kind of childhood traumas. We might ask them about their families of origin. We might ask the couple if if they have been to therapy before and what worked and what didn't work. We'll look at how they met, what attracted them to each other, what drew them to one another. So there's a lot of questions that go into the clinical interview, and that's really just getting to know those that couple as individuals and also as a couple. And um, and then we also want to get their perspective. So we ask them for their perspective of whatever it is, the issue or the relationship, but we also observe, and this is really important. You know, we do this in individual therapy, we do this in couples therapy, we do this in family therapy. We want to observe how they're interacting physically with one another. That's a really important part of the assessment. It's just those nonverbals. And um, and so, you know, where are they sitting in relationship to one another? Is one leaning towards the other, or are they just totally disconnected and disengaged from one another? So that's really important, and we can even gently confront that. I noticed that you guys are sitting on opposite sides of the room. Tell me about that. So, our observations and what we observe can lead to further opportunities for helping to get to the root of the issue and help formulate a treatment plan. Also, part of observation is um, we can observe their arguments. So, how do they handle conflict? How is it handled within the session? I mean, obviously, we don't want to listen, have them engage in conflict all the time with us or arguments, but it's okay sometimes when we just want to see how they handle it, because how they handle it in the session is pretty much how they're handling it at home. But I think it's also important to realize, especially, as a new therapist, there's going to be some challenges during this assessment process. And one is when there's intense negativity, overt anger. I've had couples like that, and just, especially when I first got into this field and was working with couples, I would just have couples that would yell and scream at each other, and I really didn't know what to do. So, it's really important to recognize your role as a counselor is helping to guide, helping to demonstrate those good boundaries. And also, sometimes we have to act as sort of like a police officer in the session. I've had to get up and put my physical presence, all, 5'2" of me, in between an arguing couple. But it's really important to recognize that you, even though it seems like the session's out of control, you really do control that session. You set the tone for that session. So, what you can do when you hear that overt anger, you can actually, sometimes I'll put out my hand like a stop sign and say, wait, let me pause for a moment. I know that this is difficult, and that's why you've come to me. So let me try to guide you and see if I can help, okay? So it's okay to interrupt. Even though many of us have been told when we were children, don't interrupt. Well, in this situation, it's perfectly fine to interrupt, and you can gently interrupt. Like I said, hey, let's take a pause. So remember, again, you set the tone for the session. Okay. And another part of assessment is doing your self-report assessment tools. So you're going to have some tools that you might like to use with clients, and these will vary depending. I mean, there's so many. I hate to even mention some of them because there's so many. But the textbook does go over a couple of them that are good, like communication patterns questionnaire, the CPQ, the brief symptom inventory. So I think the important point is to remember that the assessment is kind of a threefold process. The clinical interview is kind of like you're spreading the net wide, you're getting all this information, and you're also observing. And then the self-report tools allow you to kind of hone in a little bit. And again, when you do the self-report tools, you share that information the results with the couple, and you get their perspective on those findings, because counseling is a collaborative process. We're working with the clients to help guide them, help them find their path that they need to be on. There are many different theoretical approaches in couples therapy. But this week, we're just going to go over the behavioral approaches to couples therapy. So these are three separate approaches that fall under the whole behaviorism umbrella. And it's cognitive behavioral couples therapy, integrative behavioral couple therapy, and acceptance and commitment therapy for couples. So, what do these three approaches have in common, aside from the fact that they all fall under the behavioralism umbrella? Well, they all stem from behavioral and cognitive behavioral traditions that emphasize the role of thoughts, emotions, and behaviors in shaping relationship patterns. Remember the cognitive triangle. So, you have the thoughts that influence how we feel, that influence how we react or behave. So obviously those are going to have an impact in the couple relationship as well. These three approaches also focus on the present. So they want to look at the current relationship dynamics. They're not so much interested in exploring the past, even though our assessment that we talked about is going to look at some of the past, but that's just part of that assessment process. We want to get to know the couple, but the approaches that we use will determine the focus that we take or the path that we take. So what else do these three approaches have in common? Well, they all look at skill building. They all help couples develop better communication, problem solving, and emotion regulation skills. They're also all empirically supported. And they also take a very collaborative approach. In other words, all three of these approaches view partners as active participants in identifying the problems and creating change. So let's look at these. Cognitive behavioral couples therapy focused on changing thoughts and behaviors. The integrative behavioral couple therapy approaches integrates change with acceptance of differences. And then ACT for couples emphasizes mindfulness, acceptance, and value-driven action to build those connections and resilience. But all three of these approaches aim for a healthier, more authentic relationship, but they somewhat differ in how they define and approach change. And of course, there's some differences between the two, and I made you this nice little handy chart on the slide for you to review and just to kind of understand the differences, especially when it comes to the techniques and the goals and the therapist's role. Because remember, in each therapeutic approach, the goals are going to be slightly different, and the therapist's role is going to be slightly different. The view of the problem is going to be different. So as we continue on in the next few modules and we touch upon other therapeutic approaches, we're going to be able to compare those to these behavioral approaches. So again, every approach has different goals, techniques, therapist's role, views of the problem, and it's important to recognize each of these.